Hi y'all. Able and I's category is anxiety disorders, and we focus on post-traumatic stress disorder, obsessive compulsive disorder, body dysmorphic disorder, trichotillomania, and yeah. Anxiety disorders are a health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. Symptoms include pain, fear, uneasiness, unable to stay calm, cold, sweaty, numb, or tingling in feet or hands, dry mouth, nausea, dizziness, heart palpitations. Causes of anxiety disorders are like any other form of mental illnesses. They stem from a combination of things, including changes in the brain, environmental stress, and predisposition. Obsessive compulsive disorder is characterized by unreasonable thoughts and fears that lead to compulsive behavior. An obsession is a recurrent, intrusive thought, while a compulsion is an action to reduce the anxiety from obsessions. For example, a person might feel as though their house is unsafe and get anxiety. In order to reduce the anxiety, the person needs to check the lock on their front door more than 3 times or until the anxiety lessens. Although obsessive-compulsive includes both obsessions and compulsions, one doesn't need both obsessions and compulsions for a diagnosis. Some individuals might have just obsessions or just compulsions, but the majority of patients have both, often where the compulsion is performed to alleviate an obsession. A very common compulsion is cleaning, which often stems from the obsession with germs or contamination. Mental rituals are also obsessions that are often done to try and neutralize intrusive or what they think are bad thoughts. So a person might try and call up specific words or phrases they think are good thoughts to try and replace the bad thoughts. The Diagnosis and Statistical Manual for Mental Disorders, the 5th edition, gives specific diagnosis criteria to meet for a diagnosis of OCD. Number 1 would be obsessions, compulsions, or both. Number 2, time consuming. For example, taking 2 hours per day folding and unfolding clothes and then being late for work. It's also important that the obsessions and compulsions are not due to physiological effects of a substance or another medical condition. And number 4, not better explained by another disorder. Like most mental disorders, there isn't a known cause for OCD, though it's thought to be a combination of genetics and environmental factors. Sometimes OCD seems to run in families, and an important clue is that identical twins are more often affected than non-identical twins. It's now thought that abnormalities in serotonin neurotransmitters in the brain play a key role, though the exact mechanism is unknown. Treatment usually involves psychotherapy, medications, or both. Cognitive behavior has been effective, especially a technique called exposure and response therapy, where a patient is first exposed to the anxiety and compulsion provoking situation, ultimately showing that the anxiety actually lessens when the compulsion is not carried out. Because the cause has been linked to serotonin, selective serotonin intake inhibitors, SSRIs, have been shown to be an effective drug treatment, though they often come with symptoms and side effects that may need to be further treated with medication or psychotherapy. With the right treatment, patients often return to normal daily life and activities. Body dysmorphic disorder is a mental illness involving obsessive focus on a perceived flaw in appearance. An example would be a person An example would be a person can have a slightly larger pore than others on their face. To the person, when they look in the mirror, that single pore is equivalent to a moon crater, and believes that because of the pore being larger than the others, that they are deformed. Common symptoms are social avoidance, covering up behavior, reassurance, avoidance of mirrors. The never-ending desperate seeking of affirmation that the defect isn't as bad as they think to be, and a very focused attention to these defects, which are either imagined or microscopically existent, can cause excessive anxiety and stress that can lead to compulsive behavior. Body dysmorphic disorder treatments are cognitive behavioral therapy, medication, or in most cases, both. Techniques used in therapy can be assignments like going out and not covering up, or another example, stopping the urge to check mirrors and covering up mirrors to stop the compulsions. Causes for body dysmorphic disorders are biological and environmental. Post-traumatic stress disorder is developed in someone when they experience or witness a shocking or terrifying events. Symptoms can be intrusive memories, avoidance, negative changes in mood and thinking, changes in physical and emotional reactions, and most people after a traumatic event have a difficult time temporarily adjusting and coping, but usually get better with time and self-care. For some people, symptoms that get worse over a couple of months or years end up affecting people day-to-day life. Symptoms usually appear about a month after the traumatic event, but in some cases, it can be years before they first start to appear. Some of the symptoms can interfere with social and work situations and relationships. Treatment helps regain a sense of control in a person with post-traumatic stress disorder. A primary treatment is psychotherapy. There are also other types of psychotherapy. There are types of psychotherapies such as cognitive therapy, exposure therapy, eye movement, distanciation, and reprocessing therapy. Medication as well improves PTSD symptoms to be able to handle therapy and help the person function normally. The therapist can help develop skills to manage the stress to better handle the stressful situations. The type of therapy is based on your needs. The type of therapy is based on your need are free to try any type of combination of therapies that to best fit your need. Group therapy also helps because it gives you a chance to connect with people that are going through similar experiences. Some medications do have the potential for abuse, so people with PTSD have to be mindful of that. Trichotillomania, also known as the hair pulling disorder, is a recurrent, irresistible urge to pull out hair from scalp, eyebrows, and other places. It leaves patchy bald spots, causes distress, and can interfere with social and work functioning. People usually pull their hair in private due to the embarrassment, and it is mainly shown with teens who are 10 to 13 years old, who are in very stressful situations. And it is genetic as well. Symptoms include increased sense of tension between pulling hair, sense of pleasure or relief after hair is pulled, biting, eating, or chewing of pulled hair, repeatedly trying to stop pulling out of hair without any success. Signs of this disorder can also be pulling hairs from pet and dolls. For focused hair pulling, some people may have a ritual to pulling hair such as finding just the right amount to pull out. It's related to emotions such as negative emotions, which is people pulling out hair in order to deal with stress, anxiety, loneliness, and boredom. Positive emotions is when they pull their hair because it's satisfying and causes a sense of relief. People with trichotillomania may also have depression, anxiety, and OCD. Treatments for trichotillomania are habit reversal training, cognitive therapy, acceptance, and commitment therapy. People may feel shame or humiliation that they have the disorder and may avoid going out and any type of social activity and will go to great lengths to hide the fact that they have the disorder. And that's our presentation. Thank you.